Hello and good evening, everyone. Welcome to our 77th Blue Hills Virtual Seminar. Blue Hills Virtual Seminar is a platform that allows healthcare professionals to discuss current management updates of different health-related topics for better patient care. And this platform is brought to you by Blue Hills Ethiopia, a medical consultancy company founded by medical doctors and a computer engineer. And we aim to be an influential healthcare leader in creating a skilled community through easily accessible knowledge in preventive medicine. And I'm your host, Dr. Iheno Tadela, a general physician and first aid trainer from Blue Hills, Ethiopia. So our today's virtual seminar is a pre-conference CME session on digital health for the 8th Ethio Health Exhibition and Congress, which will be held on March 7 to 9 at Millennium Hall. So we have two special guests for today's seminar. Dr. Abel will be our moderator on today's session. He's a digital health project manager at Orbit Health and a co-founder of Social Duty Alliance. Dr. Abel is passionate about sharing his knowledge and insights on digital health. He runs a weekly LinkedIn newsletter called Digital Health Digest. It's a pleasure having Dr. Raphael Akombe here with us. He is the speaker on today's session. Dr. Raphael is an accomplished digital health and information management consultant and a lecturer with over 20 years of experience, both in healthcare system and in higher institutions. He had his PhD in Health Management Information System in 2016 and recently had his second PhD in Digital Health and Health Informatics in 2023. He has an extensive knowledge in digital health system and health information technologies and their applications in healthcare settings, and we are thankful for presenting on the session. So, Dr. Abel, the stage is all yours. So, can you?
Thank you, Dr. Iheno. Good evening, esteemed guests and digital health leaders. I'm Dr. Abel. I'm a digital health project manager at Orbit Health and a co-founder Social Duty Alliance or SCDA. Apart from that, I run a LinkedIn newsletter, a weekly LinkedIn newsletter called Digital Health Digest, where we curate and analyze latest news, trends, and best practices in the field. Before going to the seminar, I'm delighted to invite you to the 8th Ethio Health Exhibition and Expo. So it's an Ethiopian leading international trade show for the healthcare, wellness, medical, and pharma technology. This year, we spotlight digital health as the key to achieving universal health coverage. We have an exciting lineup of activities, including panel discussions on scaling up digital solutions and current state and prospects of artificial intelligence in healthcare, and also seminars regarding the future directions in EMR implementations in Ethiopia and the skills and competencies needed for digital health leadership as well. And we have also an exciting event regarding to the Digital Health Hackathon, where we have a 48-hour Digital Health Hackathon where a team of 6 to 10 compete for amazing prizes. I'm delighted to welcome you all to our seminar on how digital health tools can enhance efficiency and quality of healthcare in Africa. The seminar aims to explore the potential of digital health tools in transforming healthcare delivery in Africa. We have partnered with Blue Health to create and spread the knowledge about digital health, especially in Ethiopia. We hope this platform will serve as a conduit for learning and sharing experience and knowledge base. Our presenter for today is Dr. Raphael. He's an accomplished digital health informatics consultant and a lecturer with over 20 years of experience in healthcare systems and higher institutions of learning. He has an extensive knowledge of digital health systems, health information technologies, and their applications in healthcare setting. He is a prominent local and international conference speaker and has authored several books on health informatics. He is the current and first data protection officer for Lagos State of Ministry of Health and a board member at the Society of Telemedicine and Health in Nigeria. So I will go to Dr. Raphael. Thank you for joining us today. The floor is all yours. You can continue, Dr. Raphael.
Thank you very much, Dr. Abel. I want to say a big thank you for bringing me to this platform to have this very robust interaction with people from around the world, particularly in Africa. We Africans are growing in a very tremendous form, such that, when it comes to healthcare setting, we are already tapping into the system that is going to make healthcare to work. And I want to really appreciate the Blue Health for this initiative, Blue Health Ethiopia, for this very great initiative. And, I believe strongly that in no time, Africa nations will begin to be on the page of global, system where everybody will know that Africa has really come to take its rightful position. Like I said, it's a very great opportunity for me to discuss how digital health tools can enhance the quality of healthcare in Africa. I will be looking into different area, but particularly I'll be using three African nations as a case study, where we are going to be seeing how we are growing in digital health space. The WHO, have set up a standard when it comes to digitization. The standard has been set that every nation must be ready to follow that pattern in order for us to be able to achieve the universal health coverage. And this is one of the reasons why we have come to sensitize ourselves and to encourage ourselves, to educate ourselves about what is happening in African nations as regards healthcare technology. Now, we have this content here. I have just this 5 content here, which I'm definitely going to really handle within the time allotted to me. We'll talk about the introduction, the sources of digital health efficiency gain, advancing the digital health landscape in Africa, and market increase in digital health. And we come into conclusion. Now, we all know that COVID-19 have actually transformed so many things in the global world. And there is no how, we can be talking about digitization of healthcare in a very high dimension that we are seeing it today without making reference to COVID-19. COVID-19 really dealt with the global village in such a manner that many people find it very hard to move out the way they should. And of course, the instructions were passed from one country to another that people should not be moving out anyhow, so that the virus will not be transmitted easily. And we know that that was during the time everybody was wearing nose mask, and to even have an handshake with anybody around is a very big issue. So, and it was made difficult for every individual to access healthcare the way it should be. And that was the reason why technology started making its way, by making people to be able not to just die in their homes, but have access to healthcare system while in their various homes. So the COVID-19 pandemic highlighted the importance of digitalization in supporting access to essential healthcare service in the most remote areas, particularly those areas where it is very hard to reach, where even the primary healthcare centers that are built in various villages are not enough to really give enough healthcare services to people within the hard to reach areas. So the technology was introduced, and people were able to, even from the comfort of their home, to be able to have access to healthcare facility. Now, digital health in most African regions is still at the infancy rate. Now, it's still growing because there are so many factors that are making digitization of healthcare system not to spread the way it should within the African continent. I'm still going to talk about a few of these factors later on, but it is very important for us to know that human is one of the major factors that is making digitization of healthcare to be slowing down. Talking about the healthcare practitioners and the patients and other infrastructure as well. So these are part of the reason why the healthcare system technology is slowing down in the African continent. It is a very good news to know that Ethiopia is bringing up this initiative whereby the people within the Africa setting will be able to know that healthcare system is not business as usual. It has been transformed in a way that everybody will be able to have access to it, irrespective of your location, irrespective of who you are, your personality. Healthcare system has been made through technology very available for all. And another thing we need to talk about is that because mobile technology, is virtually within every nook and cranny of our continent today. So it makes it much easier for people to be able to have access to healthcare system, either through phone calls, through WhatsApp call, any social media. These have been made very easy. And we should also know that, in the line of this, when we are talking about digitization of healthcare system, we need to make sure that, we understand one particular tool that is very, very important. That is talking about data. Data is key to every successful healthcare system. So where data is lacking, there is no how healthcare system can thrive. So it is very important that whenever we're talking about digitization of healthcare system in African continent, data is very important to also take note of. Then let's also move into the aspect of the application that is being used for to create a kind of platform for every individual to be able to have access to healthcare. Now, the WHO has stated in the policy statement that every application or solution that is going to be used to link healthcare facilities together must be able to have a quality handshake with one another. We know we have so many vendors that are developing different applications when it comes to electronic medical records, when it comes to electronic health records, telemedicine, telehealth, AI in healthcare, blockchain in healthcare, and so many other applications like that. So it is very important when these applications are designed for them to be able to have a handshake interoperability, for this application to have the capacity to access one another, to exchange health information. This is one of the very important aspects that we really need to look into. Now, the next one we'll talk about the sources of digital health efficiency gain. Yeah, well, globally we talk about this, but we are focusing on African continent now. And just like I mentioned earlier on, I'm going to talk about three African countries. I'm talking about Kenya in the east part of Africa, Nigeria in the west part, and the South Africa as well. I have been reading a lot about Ethiopia healthcare system, and I was so glad when I saw that Blue Health is really making waves when it comes to digitization in healthcare system. And this is part of the effect of the Blue Health again in ensuring that every citizen, every African have the great knowledge that has to do with healthcare technology. So we'll be looking at the sources of digital health efficiency gain, and I have 6 categories of digital health tools here which I'm going to talk about. The categories are more than 6, but I'm just limiting it down to these 6 categories. And shifting to virtual interaction, which is one of the categories, and going into paperless, whereby the world is tilting towards now in ensuring that anything that has to do with hard copy paper is something that we need to really be doing away with gradually. Although there is no how we can eradicate paper records now, because people are still getting used to understand what technology in healthcare is all about. Even in developed countries like the United States of America, United Kingdom, Canada, and so on and so forth, they are still, operating on the hybrid. That is talking about the digital and paper. So gradually we'll be moving as, the technology is increasing in ensuring that we are meeting up with the standard in ensuring that we have good healthcare services in all our healthcare facilities. Now, I'm going to look at the first category among the sources of digital health. Now, this is talking about the virtual interaction. We know virtual interaction is exactly what we're doing currently is about virtual interaction, right? We are, communicating together virtually, and in healthcare system, virtual interaction is one of the key area that is helping the healthcare system to grow effectively. Now, virtual interaction accounts for approximately 43% of potential efficiency gains in Kenya, and 35% in Nigeria, and 39% in South Africa in the next 2030. So which means that in Kenya, by the year 2030, we should be, realizing about $1.1 billion, as the technology begins to grow. In Nigeria, $1.2 billion, and in South Africa, $4.3 billion. Wow, we look at it that, why is South Africa, going to be much higher than, the other African countries? Well, the truth is not far-fetched, because when we look at the South Africa, the rate at which the technology is really growing, the development is growing there, is very encouraging. And it's so glad to know that every other African country too are also, are following suit. Now, looking at this virtual interaction, there are 3 major, technology that is attached to this virtual interaction that is making healthcare system to be much more robust. That's the first one, talking about the teleconsultation. That is talking about the remote interaction between healthcare professionals and the patient. Like I said earlier on, the technology has grown to the extent that you don't need to go to the hospital physically before you can get attended to by your physician. You can see your physician, you can see your doctors, you can access your healthcare services through teleconsultation. It is a kind of application that is used in order for both doctors and patients to be able to have a very good interaction together. So this is very important. Now, the second one is talking about the remote monitoring, which talks about the vital signs and symptoms, which could help providers most cost effectively manage patients with one or more chronic diseases, such as diabetes and so many other diseases like that. Now, what are we talking about here in the aspect of remote monitoring of vital signs? Now, the technology has moved to the extent that, when your physician is going to attend to you virtually, there are digital equipment that have been designed for different kind of tests that is meant to be carried out virtually. We have digital stethoscope, we have dermatoscope, we have so many other devices that will be fixed with the application, which whenever the patient from remote parts of the country is having interaction with his or a medical doctor, depending on the case that the patient is really, placing before the physician. Let's say, for instance, now, if the patient is having kind of heart-related issues, right? The digital stethoscope is available to use by the patient or by the technician that is manning the remote telemedicine kiosk, which is going to be used on the patient, and the doctor will be seeing the result from the back end to see what is actually wrong with the patient, and will be able to know whether the patient needs urgent attention that will require an ambulance to pick the patient from that location to where healthcare facility is located. Now, the third one is talking about the electronic triage, which is talking about the AI in healthcare system. We all know how artificial intelligence has really been helping the healthcare system, whereby when you go into the hospital, you have the online tools or phone services to determine upfront whether patient needs to visit an emergency room or not. So there are so many aspects of the AI technology that has been designed such that when a patient is being attended to, the AI technology is going to give the feedback to the physician to really suggest whether the patient will require certain type of treatment or not. So these are part of the system that the technology is really bringing into the floor. Now, going into the second category, talking about the paperless data. We know presently in African countries, we are used to paper records, whereby when you go to the hospital, you have to get to the medical records unit, you do your registration, and everything is documented on black and white. And of course, we all know the disadvantages of paper records, because it will get to a certain stage when the environmental factor sets in, that the paper will start getting deteriorated, and most of the documentation of the physician on the paper records, sometimes they start wiping off, leading to a kind of guesswork by the physician when they cannot really have access to the complete information of the patient on paper. So these are part of the disadvantages of paper records, and it is the reason why paperless data, paperless technology was introduced. And of course, by the year 2030, it will be in Kenya, it will be 30% will be accounted, to the paperless data, whereby $700 million will be realized in the year 2030. In Nigeria, 26%, $900 million, and in South Africa, 3.3 billion. That is another very high aspect again. And all through this session of this presentation, you will see that South Africa is still, very high. And this is a challenge to every African country to really come up together. The African Union needs to, promulgate a law, which I know they are already working on, that is going to unify every aspect of African nation together in order for us to be on the same page. So that when I leave Nigeria, for instance, now, and I'm coming over to Ethiopia, and there is a need for me to, access healthcare facilities in Ethiopia, there won't be any form of issues, because my medical records is already digitized. So it is just what will just be done is for the healthcare provider in Ethiopia to request for my information in Nigeria through consent, because all this things have been made available in electronic medical records and electronic health records. Before you can release any information, you must seek consent of the patient, you must seek consent of the healthcare providers, and so on and so forth, before the information will be released. Now, the paperless data we are talking about, we have to be integrated into electronic health record, whereby the system, the solution will have to be, relating to one another. There must be a kind of form of interoperability of the application, whereby the clinician will need to, have a very easy and smooth access to the information of the required patient. Now, the next one is talking about the e-prescribing for pharmacies, where the drug is being prescribed by the doctor. The patient does not need to carry paper from the office of the physician to the pharmacy to get the drug. Everything is going to be done digitally, and the patient gets to the pharmacy in a situation whereby everything is, the technology has improved to a certain stage. Sometimes the patient will not even need to see any pharmacy before getting the drug. There is a pharmaceutical device that is called carousel machine that can dispense drug to patient accordingly without any error. So these are part of the importance that we can get in digital health. Now, the third one is talking about intra-hospital staff communication. This is one of the very beautiful parts of it. We have in working in the healthcare facilities, doctors, nurses, medical lab scientists, health information managers. We have pharmacies and so on and so forth. And digitization of healthcare has made it very easy for healthcare givers to be able to have a seamless communication that is going to affect the growth of their performance during the working hour. The last one, talking about the artificial intelligence-based virtual assistant, which is part of what we have talked about earlier on. Now, the third category is on patient self-care, right? The patient needs to be empowered. We need to make patients to understand that they also have the rights, to know certain things in the hospital, and to also have the ability to take control of their own personal health. It includes management of applications that facilitate prescription adherence and patient education program. These are part of the beauty of digitization in healthcare. Now, patient is going to be educated, is going to be made known about what is expected of them and how they are going to be interacting with their physician through digitization. And by 2030, again, we have that, this system would have grown about 4%, which is in Kenya will be adding to the value of the economy of the Kenya by $100 million, and Nigeria 6% growth, and in 2030 adding to the economic value about $200 million, and South Africa 5% adding to the value about $500 million. So patients needs to be empowered. Patients need to be encouraged, motivated, because when patients are well motivated, the physician will find it much easier to be able to attend to them and respond to their treatment accordingly. So this is very, very important. And the fourth category is about patient self-services, which is a little bit similar to the patient self-care that we talk about. The key self-service technology examined is the analysis is ebook, right? Online portal that lets patient book clinic visits, reschedule appointment, and so on and so forth. Now, with this patient self-service, you can determine when you want to see your doctor. You have the application with you. I know that in Ethiopia, there are, because the like of Dr. Abel, must have gone very far in the area of this digitization. I remember when we were talking yesterday, he was telling me about having to go to the hospital, to attend to the EMR, which was highly encouraging, right? So it is very important where patients are given this opportunity to, decide when they want to when they want to book an appointment with their doctor, and also to schedule diagnosis tests whenever they want to go for tests, and so on and so forth. So, so these are many opportunities that digitization has really brought into healthcare system. And by giving patients greater control over their access to care, Abel could reduce the cost of missed appointment and administrative costs. Of course, in all that we're talking about, healthcare system is really going to gain a lot, because there is going to be a reduction in the influx of unsolicited crowd of patients coming to the hospital, because everything will be well organized, and every patient will know, apart from the case of emergency, when the patient will have to come to the hospital unscheduled, so that at least in order to have access to the healthcare system. Now, the fifth one is talking about the decision intelligence system. Now, what do we use in making decisions? And this is where data also comes in. It is very important that we take the place of data very serious. Without adequate and accurate data, there is no how effective decision can be taken, even in electronic healthcare system. So it is very important how we handle our data. Data is very sacred, and just like I keep telling my audiences whenever I'm talking about this, that data is equal to life. Data is as the same thing as life. Some people say that data is the current crude oil. Yes, I agree with them, but I see that data is equal to life. So therefore, this provides data-driven decision support for physicians. So it means that the data must be accurate. And by 2030, it is expected that when African nations are, very committed to this particular system, it is going to boost our economy, gradually. So by 2030, Kenya will be realizing about $200 million in addition. Now they will have grown by 9%. Nigeria will have grown by 10% and will have realized about $300 million, while South Africa will have grown by 12% and will realize about $1.3 billion. These are part of them that's very important, and performance indicators are particularly helpful for identifying quality outliers, whether positive or negative, and can also inform adjustment to decision making and operation in care setting. For example, to reduce variation in adherence to protocols. So when data are well, captured, physicians find it very easy to attend to their patient. But when data are not well captured, it will make physicians to start, getting involved in guesswork, which can jeopardize the life of the patient. But in the case of digitization of healthcare, it is going to be much easier to capture data, to monitor the data, to analyze this data, and to use this data for effective decision making. So this is part of very important aspects that we need to understand. Lastly, in the area of the 6 categories that I've mentioned earlier on, is workflow automation. How does the workflow? This will improve the patient experience and the quality of data for clinical decision making, just like we mentioned earlier on, right? The patient experience, the patient must be involved in whatever they are doing. Gone are those days. I think this aspect, is very peculiar to us in African countries, whereby we, sometimes when patient is demanding, for a certain information from healthcare givers. I don't want to mention any particular healthcare givers now, but sometimes we find it difficult to express ourselves to patients. But, I want to tell us this evening that patients have every right. Every patient has every right to have the knowledge of about their medical records, about their healthcare status. So it is very important. Now, mobile connectivity via tablets, for example, will provide nurses in clinic and in remote area with full access to patient information and enhance their ability. So gone are those days whereby you will need to have to wait until the paper record of the patient will be transported to a particular location before anything can be done on that patient. Now, the workflow automation, where digitization has come in, is really going to make the work of the healthcare giver much easier. The access to vital information that is going to help in supporting the patient healthcare services is going to be made available at every point in time. Now we're going to talk about the advancing the digital health landscape in African nation. This is very important area that we need to really look into, and this is where the government of African nations needs to really come together in order for us to be able to achieve what is expected in African nations. Because if we look at the statistics of disease prevalence in the world today, we were told that African nations contribute to more of the disease burden in the world, right? Why is it so? The reason is not far-fetched, because it is known that we don't have enough infrastructure, we don't have enough ends, and now that we're even seeing our medical doctors in different African countries migrating into Western world, to find a green pasture, simply because the working condition within the African setting is not conducive enough. And this is one of the reasons why you see doctors migrating into another Western world. You see nurses migrating into another Western world. But when African leaders come together to work on the policy, the strategy that is going to make healthcare system to be much more conducive, both for the healthcare giver and patient, we will see that everything is going to be transformed in African nations. Governments in Africa are increasingly setting strategies, just like I said earlier on, and allocating funding for digital health, shaping regulation and policy around it, and exploring opportunities to expand digital health adoption. I know African Union, because there's a document I have in my custody, which I was given from a friend in the in African Union, which was very impressive. The African Union is really working hard to make sure that they unify the entire Africa in some major areas, talking about the healthcare, the agriculture, and education, so that at least people in Africa will be able to have seamless access to all these areas, and for them to be able to have a relaxed mind in order to be able to do what they want to do. Additionally, donors and partners are really coming into African countries, because they have seen a lot of very fatal ground in African countries, that this is the place to invest, particularly in the area of digitization. I have quite numbers of developers, application developers, solution EMR developers, telemedicine, telehealth, that have reached out to me in various ways to come into Africa to bring in their solution into Africa. But there is something I always discuss with them, which they are still finding it difficult to make, and I want to really discuss it with us here. Now, it is easy for us to get third-party vendor to bring in the application to African nations, but the question we need to ask ourselves is this: the application they are bringing into our continent, is that application able to speak our language? When I say language, I'm not talking about the dialects now. I'm talking about understanding the culture of our African continent. There is one thing for you to come in with an application. Another thing is for your application to speak into the need of Africans. So these are part of the area we need to look into, and the government of Africa need to look into, not just to start adopting any solution into our healthcare system. At the end of the day, we discover that this solution doesn't last. At the end of the day, it crashes. Because what? Because we've not been able to do the due diligence to check through this application to know whether this application can actually speak the language of our community. So these are part of the area we need to really look into, and both all the stakeholders need to come into this area in ensuring that this aspect is properly handled, so that most of the application or solution that are being brought, healthcare solution that are being brought into African country, will not just come around to cause havoc in our system. And another area I want us to talk about here, because I'm rounding up gradually, I want us to talk about in this area of advancing the digital health landscape in Africa, is that when we are adopting any electronic medical record solution in our continent, in our countries, it is very important for us to really understand how about the integrity of our data when it is being captured from the patient. We need to ask a lot of questions. The data that we capture from our patient, where is this data going to? Where is this data going to be seated? Is it going to be seated within Africa, within our country, or it is going to be seated in another country where we don't actually know what is wrong with our data? So these are part of the data. And of course, like I said earlier on, data is equal to life. Data is another oil, another crude oil entirely, that can liberate, that can change the status, our financial status in African continent, only if you can get to know how to handle our data well. There is one thing for a system to capture your data. Another thing is for that data to be secure without it being have any any leak somewhere in another country, whereby some people will be making use of this data to make money, while the African countries will continue in abject poverty. So we need to take note of this. The African government, the African Union need to look into this very well, because if we don't look into this, our data will continue to be used to make money, and nothing is going to be done. The Africa will remain poor, and those people that are bringing in this solution will continue to keep getting richer and richer. So this is very, very important. The IT infrastructure and digital readiness are improving digital health affordability and adoption in the African region. And this is one of the reasons why we need to really, embrace this digitization in our healthcare system. Finally, I'm going to talk about the aspect of market increase in digitization, in digital health, in healthcare system. So we'll talk about this and I will round up. Now, the market increase in digital health, there is an opportunity to introduce more integrated digital health offering at scale in Africa. This is very, very important. This is part of what I said earlier on, that the government needs to come in together in order for us to be able to speak with one voice when it comes to digitization of our healthcare system in African countries. So it is very important. Doing so will take a concerted effort by multiple stakeholders like public health leaders, payers. When talking about public health leaders, talking about the government, the payers, that's talking about the insurance, the providers, that is the healthcare givers, and startups, that is talking about the companies, that are coming up to support the healthcare system, working in parallel in order to accomplish the following. Number one, to establish an enabling ecosystem. This is very important, as in other countries, African government will start with national digital health strategies that include measurable targets, roadmaps, and budgets. This is going to help us in African continent. If we can just, if our African Union can come together to establish an enabling ecosystem. Number two, demonstrate new or existing value. We have our value already. Digital health ecosystem participants will then work to identify the most pressing health system performance issues. For example, access, quality, efficiency, or resilience, and the digital tools that could improve not only efficiency but also patient access, convenience, and outcome. So the digitization of healthcare system is not just to put it there that, we have also gone digital, but it must be able to meet the patient's need, so that the value that we are having there before will be maintained, And lastly, to scale and sustain existing value. Talking about the social service and public health organization, this could promote the use of certified digital health tools. What do I mean by certified digital health tools? The certified digital health tools are the tools that have been scrutinized, properly looked into, that this can actually meet the need of African healthcare system. And at the end of the day, the delivery of healthcare is going to be so fantastic that everyone will be able to have a very good, outcome at the end of it. And lastly, in conclusion, I want to just use it to just encourage African leaders, African countries, healthcare leaders, the stakeholders, that African countries could bolster health system efficiency through expanded use of digital health tools. This is very important. There is no going back about digital health tools. Like I said, electronic medical records is making waves. There are so many qualities that is embedded in electronic medical records. Let us get this very clear. Electronic medical records is different from electronic health records. Both have different scope. Electronic medical records, focuses more on the on-premise activities, clinical activity that is going on. While the electronic health records goes beyond the hospital premise. It goes beyond there, whereby the health information can be exchanged and the application can be able to speak to one another in order to facilitate the care of the patient. Now, the continents have the potential health efficiency gain and could be up to 15% by 2030. These are part of the things, the gain that we can do, that we can achieve by the year 2030 if everybody can actually, have the understanding of what is going on. Expanding use of virtual interaction and shifting from paper-based to interoperability in digital health data exchange system are the most promise to realize efficiency gain. So in rounding up now, it is very important. Digital health in African country has come to stay, but it cannot be effective if every one of us are not working towards its actualization. A lot of things are happening. I said something earlier on when we started that there are so many factors that are leading to the snail movement of digitization in healthcare system in Africa, and everybody have their own contribution into it, starting from the healthcare givers. They're talking about the doctors, talking about the nurses, talking about the pharmacists, the health information managers, talking about the medical lab scientists, and many other healthcare workers. Majority are somewhat afraid of using technology, of shifting from traditional way of practicing into technology. And this is one of the reasons why we're having a setback. It surprises me sometimes that when African brilliant doctors, are finding it hard to adopt this technology in our African continent, but when they travel out of African continent to another developed country, they have no choice but to adapt with their system over there. So if we can do that in another country, I think there is a big need for us to be able to start making that practice here in Africa in order to ensure that our continent is well secured and well equipped in the area of digitization in healthcare system, so that by the year 2030, the developed nation will see a vast development in the area of healthcare system in African countries. I'm not talking about a particular country in Africa, but I'm talking about the African country as a whole. This kind of initiative that is brought by Blue Health is something that needs to be carried around the world, and to create this awareness to everybody around the world that this digitization of healthcare system is going to improve the healthcare services in our continent. It is going to reduce the mortality rate. it is going to reduce the morbidity rate, and it is going to make everyone to be lively and live longer as it is expected. Thank you very much for this great opportunity. I appreciate you for this time. Thank you.
Thank you, Dr. Raphael. It was an amazing and insightful presentation. Towards few initiatives regarding to our country in Ethiopia, what's been currently started. We have the HA project, which is called a Digital Health Activity Project. It's a 5-year project which is supported by the USAID. Currently, I am one of the lead in the AMR implementation project. We have been supporting the health facilities and Ministry of Health for about 5 years now. Apart from that, there is also an initiative related to the SHIS, or Electronic Community Health Information System. The government is digitizing community health information system, and they are currently trying to bring tools and networks into place to digitize data, automate workflows, and also enable health extension workers through their empowering their performance management and supervision as well. Before that, there was also a tool which was used for the COVID. So during the COVID-19 pandemic, a digital tool was developed, integrated with SHIS digital platform, and this was also used to track and help health extension workers and other health professionals in fighting the COVID-19 pandemic. Even though the adoption and implementation of digital technologies or tools in full capacity require more training, access to better device and infrastructure. Thank you again, Dr. Raphael, for the presentation. So we're heading for the Q&A. So if for participants, if you have any questions, suggestions, you can start. Okay, so we have the first question by Asafa Sunta. So the question goes, how can we digitalize remote area health systems? Remote area health systems.
Yes, the digitization of remote area, just like I mentioned in one of the slides, that the purpose of technology is not just only for the urban area, but the purpose of technology in healthcare is not just only for the urban area, but majorly for remote area, because the large people are living in remote area who are having issue of access to healthcare. And digitization of healthcare in remote area is one of the things that the African Union has been working on. And just like I mentioned these 3 countries, and I know that in Ethiopia too, it is also working. The remote area, we have, telemedicine and telehealth, solutions that can be used to reach out to, the people in remote area, whereby, there are some places in remote area where they don't have access to road transportation, and some are crossing by through, by water. Right, but in this area, when telemedicine kiosk is established in those areas, and they have, a technical person that is, attending to people within that remote area, it is going to make healthcare to be much more accessible. We have a lot of, application, telemedicine application, we have telehealth application that can be used, whereby patients in remote area will be seeing doctors in urban area or anywhere in the world, depending on the policy of the country, whereby if the doctors, if the healthcare system in that country, can allow doctors from another country to attend to patients, depending on the policy of that country. So telemedicine and telehealth gives a vast opportunity to people in remote area to have the same quality access of health care, at any point in time. It all depends on the government of the country to determine how the pattern at which they are going to take. Like I said, there are so many telemedicine. I mean, Dr. Abel, you can bear me witness. There are so many telemedicine, applications that can be used to, reach out to the people in remote parts of the country, wherever you may be. It will be there. Well, you may be asking that, what if there is no electricity to power? That is where the solar power comes in. Every telemedicine kiosk comes with, should come with solar power, whereby the places where there are no electricity, the solar can power the gadget in there to enable the patients, the villagers, to be able to have access to healthcare as at when due. Thank you very much.
Thank you, Dr. Raphael. To add on that, actually, there is a company called Mobile Health International, which I came across recently. It's a telemedicine and digital health platform. The company is founded in UK, currently practicing in Nigeria. So currently they are working on telemedicine. They have a lot of millions subscriptions, and mostly they are from remote areas. And what they are currently doing is wonderful. So they have affordable, and they are trying to provide affordable and quality healthcare to everyone, particularly in remote areas. And currently the platform is utilizing AI and IoT, Internet of Things, powered remote point of care, and diagnostic, and utilizing diagnostic tools as well. So they are currently expanding as well. So the role of telemedicine in providing telehealth service and home care is really great. Okay, I think. Okay, the question is from Ermias Bakala. So he's asking, how much does it cost to install EHR in a single health facility? So you can, Dr. Raphael, you can tell us about Nigeria's experience, and I can add regarding the Ethiopian one.
It's talking about how much does it cost, right?
Yeah, to install and deploy an EHR product in a single
electronic health records. Now, talking about, it is very difficult to really talk about, the cost here, because it varies. Now, when you want to, adopt or implement digital healthcare, particularly the area of electronic medical records, or EHR, there are so many areas that we need to look into before you can start talking about the cost. Now, you look at the infrastructure, that is the facility. You look at, okay, how many bed space do they have in there? How many consulting room is available? What is the volume of the paper record, that is the physical records they have in there? It is very, very important, because we are talking about digitizing the medical records to make things easier for the healthcare givers. So it is very important to look at the volume, and not just the volume of the number of the case notes we have, but also each case note we have different documents. All these things will be calculated, one after the other, before you can transfer them, through EDMS, that's Electronic Documentation Management System, for you to be able to know how much is going to cost in that area. Then talking about how many rooms hospitals, how many consulting rooms, in order to determine what, how many hardware that is going to be required, and talking about the aspect of the number of doctors, the number of nurses, and the other aspect of the. So there are so many things that need to be put into consideration. The power is also part of what is going to be used to cost. So depending on the country, that will determine what the cost of the power will be. All this is going to be factored together before you don't just bring in electronic medical records into hospital to start implementing. You discover that there are so many applications like that were implemented, and at the end of the day they crashed simply because due diligence were not carried out. So there are some feasibility studies that must be carried out. Even in Nigeria here, at least in Lagos, for instance, now we have most of our healthcare, secondary healthcare facilities are already digitized. They're already making use of electronic medical records, and our tertiary institutions are already digitized. The primary healthcare are now getting digitized bit by bit. So, but before we can do anything, we have to visit the site. The site A may be different from site B because of, number one, the volume of the patient and so many other factors that need to be put into consideration. So it may be very hard to really talk about the costs of installation or implementation of electronic medical records or electronic health records. Let's talk about electronic medical records anyway, because we're talking about facilities now. If it is electronic health record, we now talk about the government of that country, because the government of the country will have to be the one to handle the aspect of electronic health records, whereby the Ministry of Health in Ethiopia, for instance, now we have the dashboard that will be able to access every hospital in Ethiopia, both public and private hospital, to know what is going on in different hospitals. The dashboard is going to be created. All these parts, all this area, required costs, right? So and all this is just to make sure that proper monitoring is being monitoring and evaluation of the activity that is being carried out in various facilities are being taken care of. So permit me to say that it may be kind of difficult if I'm giving you the cost now, whether in dollar or in naira or in Ethiopia currency. I may not be very sincere with you, but there are some physical assessments, feasibility studies that must be carried out, on-site studies that must be carried out. And there are a lot of parameters that need to be checked into before you can start thinking about pricing. Thank you very much.
Thank you, Dr. Raphael. Actually, it's kind of a difficult and challenging question. So when it comes to our country's experience, there are a lot of private companies that are providing AMR solutions to different health facilities. So they have their own way of handling, estimating the cost. But before that, there are some, when we talk about the standard, currently the Ministry of Health has published an EHR standard and also an EMR standard as well. So there is also a digital health blueprint on that. So it was published and distributed last year. I think it was on 2022. So there are requirements that the government stated there, so that every AMR or HR should fulfill some of the criteria on that, be it on open source or proprietary. So with that, we can show you some of the companies that you can check out their service, and also the government of Ethiopia, Ministry of Health. We have also provided the open source to our current EMR, which is based on Bahamni. So you can also contact the Ministry of Health in getting that freely. Okay, for the next question, it goes from, it's from Munali. The question is, I believe the main challenge facing digitalizing is the healthcare providers themselves. They are not ready to adopt the digital technology. How this challenge could or can be solved? So, Dr. Raphael.
Okay. I am going to approach this, question this way. During my presentation, I was making mention of African government, and talking about policies, right? One thing is very sure, that where there is no law, there is no sin. But where there is law, when you go against the law, you will be sanctioned. So it is very important when, the government decide to promulgate a law that is going to establish the compulsory adoption of, digitization in all healthcare settings. And of course, the law will have to state that when you cannot, comply with this law, it means that you are not fit enough to run either clinic or hospital, in this country. So when the law is established, but before the government can even say they want to promulgate a law, they must make sure that they provide all the necessary amenities that is going to help the adoption of digitization of healthcare to be smooth in that country. So it is very important. There are so many people that want to reject, the adoption of, digitization in healthcare for so many reasons. Number one, the cost of it. Some may not be able to have the wherewithal to be able to avoid and to afford the cost of digitization. Number two, the training. Some people will look about, okay, am I still going to go back to start going through the training again and stuff like that? That is, the other. Number four, the infrastructure. These are part of the things that needs to be looked into. Now, if we want to adopt digitization in healthcare system, the government must make sure that the issue of power is resolved, if not up to 100%, but at least about 70% of the issue of power should be resolved, and the alternative power also should be made available as well. So it can only be effective for the adoption of digitization in healthcare system in any country only if the government showed interest to it and decide to promulgate a law that is going to bind every citizen in that country, that is operating any healthcare setting, whether pharmacy, whether hospital, and stuff like that. Because, for example, in Nigeria now, we have quite numbers of pharmacies that have adopted digitization, in their operation. So some are connected to some hospitals. The hospital will electronically request for certain, drug or medication from the pharmacy, and the pharmacy gets it from the other end and do the supply without any human interaction. So when the law is being promulgated, I think this is going to make it a lot easier. I hope I'm able to answer that question.
Wonderful. Thank you, Dr. Raphael. I think for the sake of time, I will go for the next question. It's from Robert Olesa. Ethiopia has a majority of hard to reach areas, and there is a great challenge even in communication lines. So what is the effective strategy to digitize primary health settings?
What is the...
So, okay, let me repeat the question.
Okay.
Ethiopia has a majority of hard to reach areas, and there is a great challenge even in communication lines. So what is the effective strategy to digitize primary health settings?
Okay, thank you very much. It's not only Ethiopia that has a lot of hard to reach area, we have it in different countries as well. But talking about Ethiopia now, it is still going to be boils down to the government to be able to strategize, their plan on how to reach out to the hard to reach areas. For example, now, if the government give, the opportunity to the public-private partnership, right? Because government cannot do everything alone. The public-private partnership is one of the, very key area that is really going to help the government to be able to achieve their aims. So there are some private sectors that can be involved in funding us, sponsoring these projects in different hard to reach areas in collaboration with governments. So, proposal needs to be written, and some private organization, public-private organization needs to be identified to see how they can key into this area, to help the people in the remote part of the country to have equal access to healthcare system. Like I said earlier on, there are some feasibility studies that needs to be done. The on-site, study needs to be done. The places need to be visited to really look at the places where things, the project can be established in those hard to reach areas. Then the government, once the public-private partnership, has been involved, then the government will give a very good backing and a good law to support that project in that community. I'm going to give an instance of an organization, a foundation that wants to build a rural medical center, right? A rural medical center, and there's no how. Is a private, entity. There is no how they can get access to build rural medical center without the approval of the government. So the government needs to be involved in this area. There are so many private, sector in Ethiopia that can be approached when they are given the proper proposal and they see the beauty of how lives will be saved and how it's a business. They will approach it in both angles, value and also business angle, whereby they know that okay, we want to help people and at the same time we want to make money like that. So all the things will be subsidized and people will be able to have access. It is going to be a long-term profit at the end of the day when they invest their finance into this project. And of course, many people within the community will also appreciate that gesture. So it is very possible to extend the digitization into out-to-reach area if there is a very strong mutual agreement in public-private partnership in Ethiopia and so also in other countries. And this is going to make a lot of waves once this thing has been established. Thank you very much.
Thank you, Dr. Raphael. So as we conclude our seminar on how digital health tools can enhance efficiency and quality of healthcare in Africa, it's evident that the African continent holds immense potential for health efficiency gains through the expanded use of digital health tools. The shift from paper-based to interoperable digital health data exchange systems coupled with expanding use of virtual interactions promise to realize efficiency gains. By 2030, this advancement could bolster health system efficiencies by up to 15%. In essence, the future of healthcare in Africa is intertwined with the adoption and integration of health tools. As we navigate this digital transformation, let's remember that our ultimate goal is to enhance the quality of healthcare for all Africans. Thank you all for your active participation and insightful contributions. Let's continue to learn, share, and innovate for healthier Africa. Thank you, everyone. Thank you, Dr. Raphael, again.
Thank you very much. I'm really honored to be here. Thank you, everybody, for listening. Thank you so much. Really appreciate you. All right. Thank you.